Good evening, everyone. My name is Lam Kumar, and I'm a She Votes Illinois board member. Thank you so much for joining our event, Menstrual Equity in Action, a student advocacy panel with She Votes Illinois and Northwestern's menstrual equity activists. We have an exciting and engaging night for you planned, and we hope that you leave with a better understanding of the importance of menstrual equity and how you can make a change in this space today. Here are a couple reminders. Closed captioning is available. If you'd like closed captioning, click on the CC button on the bottom toolbar. Feel free to also post any questions in the chat during the panel. We'll answer as many as time allows, and we'll provide written responses to others after the event. I'd also like to take a minute to thank our partners. We're grateful to Northwestern's menstrual equity activists for partnering with us. Thank you for your support and advocacy to advance menstrual equity in our state. We're about to get started, but before we do so, I'd like to share a little bit about myself and She Votes Illinois. My name is Leah Kumar, and I'm a senior in high school, ready to attend college next year as a public health major on the pre-dental track. I was first introduced to the issue of period poverty on a vacation a few years ago, and soon realized that this issue was not so far away from home. It came to my attention that many young girls in my area were facing period poverty due to a variety of reasons, and this is when I knew that I had to be an advocate. I initially reached out to Representative Barbara Hernandez, actually, and she's on this call with us today, and she introduced me to She Votes Illinois. I joined the board in 2025, and since then have been helping out with initiatives related to menstrual equity, such as our Menstrual Equity Handbook and more. Also, if you're following along with She Votes Illinois' Menstrual Equity Week, we have so far had an interview with Dr. Richards, encouraged emergency menstrual equity kit making events in high schools, and yesterday was our restaurant fundraiser events in high school across Illinois. We hope that tomorrow you continue to show your support by wearing red. To share a little bit about She Votes Illinois, She Votes Illinois is a statewide political action committee making sure the political system reflects the voices of all women, femmes, and girls. Since 2019, we've led a menstrual equity initiative aimed at ending period poverty, advancing gender equity, improving public health, and upholding the dignity of all menstruators throughout the state. As far as the format for tonight, we'll start with a 40-minute panel, followed by a Q&A session, and then close with calls to action. Thanks everyone for joining us. This is sure to be an informative and engaging event. Throughout the evening, we'll also be sharing audience polls to learn more about how you're advocating for menstrual equity in your communities. We'll start with our first polling question. How have you engaged in menstrual equity activism in the past? Hosting menstrual product drives, supporting menstrual equity legislation, social media activism and raising awareness, volunteering, or you're new to menstrual equity activism. Okay, let's talk about the results really quickly. As we can see, many people have hosted menstrual product drives, which is amazing, supported menstrual equity legislation, and have volunteered. This is all awesome. I quickly wanted to give a couple disclaimers. For any questions that we don't get to that you have, we will share responses from some panelists in writing at a later date. Okay, now I'd like to welcome our panelists. I'd like all of you guys to briefly introduce yourselves, and I'll call on each one of you. Let's start with Representative Barbara Hernandez.
Hi, everyone. My name is Barbara Hernandez. I'm a state representative in Aurora. I cover areas also in North Aurora and Batavia. So I'm just very happy to be here with all of you and talk about this topic that is very important to me. And I'm always trying to find ways that we can increase access to the products, to the conversation, and also normalize it. So thank you for being here.
Thank you so much. We're so excited to have you. Next, Allison Hill.
Hi, everyone. My name is Allison Hill. I am the Deputy Chief Legal Counsel for the Illinois Department of Human Rights. Prior to my role in the Department of Human Rights, I was the supervising attorney for the Civil Rights Bureau at the Attorney General's office. Thank you so much for having me, and I'm looking forward to discussing how menstrual equity intersects with discrimination laws here in Illinois.
Thank you. Next, we'll have Ida Melby.
Hi, I'm Ida Melby. I am the founder and executive director of the Period Collective. We are a Chicago-based nonprofit that provides menstrual products to unhoused and others in need in the greater Chicago area. And our organization just turned 10 years old actually last week. So we're excited about that. But we're really excited to be here. We appreciate this opportunity to talk more about menstrual equity, and we're very passionate about it, and we're glad everybody's here.
Thank you so much. Next, we'll have Lauren Della Penna.
Hello, my name is Lauren. I'm currently a second year undergraduate at Northwestern University, and I'm also one of the co-advocacy chairs for Northwestern's menstrual equity activists. I'm originally from Florida, so I was really inspired to participate in menstrual equity in college, since Florida does not have much access to menstrual health education or advocacy in their high schools. So I'm really excited to talk today.
Thank you. And also our special guest, Senator Adrienne Johnson, who will be joining us for our legislation segment.
Hi, good evening, everyone. I'm Adrienne Johnson, State Senator of the 30th District, and that's near the Wisconsin border, Wadsworth, and all the way to Wheeling. So I have mostly Lake County and a sliver of Cook County, and I represent 15 municipalities. And I want to thank She Votes Illinois for inviting me to be a part of this panel this evening. And menstrual equity is important to me as a priority. And we have had several legislative measures pass through the General Assembly and are now laws to address this very matter. And so, in fact, we'll talk a little bit later about one of the bills that I advanced just this session. And I'm looking forward to being part of the conversation this evening. Thank you.
Thank you so much. We're excited to have all of you and hear what you have to say. Let's go ahead and get started. Our first question is for Representative Hernandez and Senator Johnson. What menstrual equity legislation is currently being worked on in Illinois, and what would it actually change for students? Representative Hernandez, if you want to go ahead and start, that would be great.
Of course, thank you. So in the past few years, I've been able to sponsor a few legislation when it comes to menstrual equity. This year, I decided to support my colleagues that have existing bills. One of them is being Representative Janet Yang Rohr. She has HB 4864, and that's a iron deficiency training bill that pretty much allows schools to annually provide training to students on what exactly iron deficiency is. I know growing up, I've always been known to have an iron deficiency, so I've always was told that I'm anemic. So for me, it was important that I take a supplement, iron supplement for this because as we know, iron deficiency can change a lot of your menstrual makeup pretty much. It could cause either not having a lot of periods or normal periods or maybe having a little bit too many or a little bit stronger of a period. So it depends on each person, but I know it's very important because a lot of women, menstruators uh, are not aware of the iron deficiency and what to do, and that is something that could be harmful to their health. So I'm very excited that my colleague is supporting this, is trying to pass this bill, and making sure that other students are who are involved in sports, especially that are exercising a lot, know that iron deficiency can also be an obstacle for them. So that is one of the things that we know that we're working on. But I know that Senator Johnson also is working on something that I'm supporting, and I've been excited to hear more about. But I will let Adrienne Johnson, Senator Johnson, explain that.
Thank you, Rep. Hernandez. It's great to be here with you as well. You know, she's doing amazing work, and I'm so proud to be your colleague. And yeah, so I want to talk about a bill that I advanced this session, and then a couple of bills that my other colleagues advanced, and hopefully they'll move to the House soon. So it's Senate Bill 2967, and it is the Menstrual Health Workplace Equity Act, and it aims to improve the well-being by allowing employees who have a documented history of debilitating menstrual health conditions up to 40 additional hours of leave time. And this is in addition to the paid leave for all that we recently passed in the General Assembly and any other existing company time off if needed. And the way this benefits some students, they have jobs as well. And if they're having this condition, and if it's to the point where it's debilitating and they need time off, they have the ability to take time off and they get paid. And it's the same thing with other women in the workplace and other people who are menstruating in the workplace. For all people who are menstruating in the workplace, they're able to benefit from that. I think another important aspect, I would say, is the salient aspect of this bill, is that it aims to break workplace taboos and improve inclusivity, and it reduced stigma surrounding menstrual health. And I know that was mentioned early on. And so that's really important. So, and that's how students can benefit from it as well. And my colleague, Senator Guzman, she advanced Senate Bill 3456, and this would require construction sites to provide reasonable accommodations, sanitary conditions, and menstrual products on the construction sites. And, you know, this bill, as Senator Guzman would share with you, it's about a safer, more humane workplaces, and it ensures that all skilled Illinois workforce are in the workplace, our needs are addressed and taken care of. And then we have other colleague, Senator Lofgren Capel. She advanced Senate Bill 2688, and this will require medical schools and nursing schools curriculum to include the study of perimenopause and menopause recognition and management. And this is important because with perimenopause, it is a stage that all menstruating individuals will go through. And so it addresses that. And we're also working on a bill with the Lieutenant Governor's office that has passed actually, and it's on its way to the House. And hopefully it'll pass. I know my colleague, Rep. Hernandez, still make sure we get the support over there. And it just requires students who in the healthcare arena who are getting their licenses renewed, they already are required to take implicit bias training. They're able to take the menopause, perimenopause training in lieu of that. And so we're doing a lot of amazing things in the General Assembly to address menstrual health equity. And I'm so glad that my colleague and I, Representative Hernandez, and our colleagues in the General Assembly, that we are working on this issue. And we know that the students, and we so really appreciate your advocacy and look forward to promoting this work that we're doing in the General Assembly and working with you in the future on improving the legislation that we advance regarding menstrual health equity. Thank you.
Thank you both for both your responses. It's really inspiring to see that this much change is actively happening in our communities today. The second question is for Representative Hernandez. If this legislation, House Bill 4864, passes, what could students expect to see change in their schools?
Yes, like I was saying, this would be an annual training that the school will have to provide. This training will include signs of and symptoms of menstrual dysfunction, low energy of availability, low bone material density, and other items too. So people are aware of what exactly happens when you are iron deficient. So that's one of the things that it's going to be having a conversation about, giving some resources to students, and being able to mitigate the impacts of these conditions. So those are some things that the students will be able to learn about at least once a year.
Thank you. My third question about legislation is for both Senator Johnson and Representative Hernandez. What do you think are the biggest barriers to getting menstrual equity bills passed, and how can students' voices help in the legislative process? If Rep. Hernandez wants to go first.
Sure. Well, I think one of the things that the barriers I've been able to face is the stigma, the stigma that people have, the lack of conversation that people want to have on this topic, especially when it comes to like my male colleagues. My male colleagues are very skittish to talk about periods or anything about menstrual, and I think changing that perspective of them, I think would help a lot. Being able to have that normal conversation with individuals is another big part of it. I think also, especially when it comes to schools, the schools don't want to add more curriculum to their teaching process. And I understand that there's a small window for a lot of the things that they're doing. However, we still need to educate and we still want to have these conversations. So this is why events like today is very important because it opens up those conversations, even if after school, and get people involved. So that's one of the things that I think I have faced in the General Assembly, just the stigma from my male colleagues, and also just having to navigate those stakeholders that might be pushing for to not have too much curriculum in the schools, or items because of politics. Politics, unfortunately, gets in the middle of this. When I passed the bill for the menstrual hygiene products to be included in all bathrooms in K through 12, I had got a lot of negative comments from parents, from people saying, why is it in all bathrooms, including male bathrooms, if they don't menstruate? So I had a lot of backlash from that too. So it can also be political, unfortunately.
And Senator Johnson.
Yes, thank you. So just to add to what Rep. Hernandez said, is really reducing the stigma. And I think that the more we talk about it, that's how we reduce the stigma. Because our male colleagues, when we normalize it and have these conversations, then they're more likely to understand because it's a reality of life, and that's something that we have to deal with. And I think it's important too, because people who menstruate, all people who menstruate, they feel comfortable talking about it to their significant others, talking about it to their friends at school and others. And so that's what we want to do about it as well. So it really depends on the nature of the legislation, what the pushback would be. So you heard what Representative Hernandez said. When it comes to schools, a lot of times we get a lot of pushback because they feel like it's an unfunded mandate. And schools, they feel like, and to a certain extent they're inundated with unfunded mandates. And so we have to be cognizant of that as well, and, and work with them. But there are some issues that are so important that we still have to advocate and push for it. And so that's what I know. And then just specifically with Senate Bill 2967, so we're getting a lot of pushback from the business community. And I imagine we'll get pushback from schools as well that employ people and if they need the time off. But I believe that it is good legislation. It is about time for us to continue to talk about it. I had the great honor to be on the panel of the Menopause Education Center, and we were talking about the Senate Bill 2967 and others throughout the United States, female legislators or legislators who are advancing this menstrual equity legislation, and they said how empowering it was when they presented the bill in committee and when they presented it on the floor, just to use this terminology. And so the more we talk about it, the more we reduce the stigma and we normalize it. And so we'll continue to plug away, and the students, with your voices, you're very helpful. I find that the students, you all are amazing advocates, and we appreciate your partnership and the work that we do.
Thank you. And because we're talking about student advocacy, Lauren, would you like to add anything?
Yes. So working with menstrual equity activists for the past 2 years have really showed me the importance of political engagement in terms of menstrual equity. That could be participating in elections, making sure that friends, family are educated about the different candidates running for office and seeing if their values align with theirs in regards to menstrual equity. Um, I also think that there are a lot of smaller things that students can do to promote menstrual equity, including submitting witness slips in support of different legislation like the ones that Senator Johnson and Representative Hernandez just discussed. It could also be sending emails to legislators saying that there is an issue in their school or in their community that needs to be addressed. Um, and also just with in regards to decreasing stigma around menstruation, just casually talking about menstruation with friends, with educators, um, to kind of decrease that stigma and make it more comfortable so that everyone can everyone can voice their concerns about their own health and also what they're seeing amongst other people who menstruate.
Thank you. I believe Senator Johnson does have to leave in a bit, so before she leaves us, please let us know if you have any questions for the senator. Okay. It looks like we don't have any, but thank you so much, Senator Johnson, for your time. Oh, yes, go ahead. Please post it
You're
in the
welcome.
chat. I think we have one coming
Oh, okay. Well, thank you. I have the sunlight shining in my eyes. It's a beautiful
in.
day in Chicago. Did you say you have a question for me?
Yes, I believe it's coming in the chat. Sorry.
Oh, okay.
Um, okay, it's right here. So, in regards to the bill that would allow for people to take time off for menstrual related issues, would a doctor's note be the only documentation needed?
So, thank you. That's a very good question. So the answer to that is no. Initially, if it's a debilitating health condition, initially just for the first time, but subsequent days off, they will not have to present uh, a doctor's note.
Okay, perfect. Thank you. Thank you so much for
You're
your
welcome.
time, Senator Johnson, and for your advocacy on menstrual
Thank
equity for
you.
us today.
Thank you. Have a great evening, everyone.
Okay, so we will continue on. This next question I have is for Allison Hill. What protections does the Illinois Human Rights Act provide for students related to access to menstrual products and equal access to school facilities?
So, as it relates to menstrual products specifically, the Human Rights Act does not create a separate protection for menstruation, but there are protections for individuals in other protected classes, such as sex, gender identity, or pregnancy-related condition. The Human Rights Act ensures equal access to facilities, services, and programs, including restrooms and locker rooms. This means that any menstruating student, regardless of their gender identity, shall have equal access to facilities that they need in order to participate in their educational environment. Other than the Human Rights Act specifically, the Illinois School Code does require public schools to make menstrual products available at no cost to students in bathrooms of every school building from grades 4 through 12 during the regular school day, which is the bill I believe that Rep. Hernandez was referring to. If there are concerns that a school district is not providing said products, that they should be reaching out to Illinois State Board of Education, which is the primary agency responsible for enforcing the school code, and that they can direct students to the appropriate resources to make sure that those products are available.
Thank you. I think you might have touched on this a little bit, but when schools fail to meet state requirements around menstrual products, what does the complaint or enforcement process typically look like?
Well, I can't speak on behalf of the State Board of Education, but on the behalf of the Illinois Department of Human Rights, if a student has a concern that they are being discriminated against based on their protected class, they should be filing a charge with the Department of Human Rights. That charge will be assigned to an investigator who will investigate the claims, meaning they'll talk to witnesses, review any evidence, and come up with a findings report at the end of the investigation, which will then be turned over to an Illinois Department of Human Rights staff attorney for review and filing with the Illinois Human Rights Commission, which is the adjudicatory body for discrimination charges in the state of Illinois. So IDHR investigates claims and brings the claims, and the Human Rights Commission adjudicates those claims.
Got it. Thank you. Now we'll have our next polling question. What kind of policy change would make the most impact? I believe it's getting posted. The answer choices include adding comprehensive menstrual health to sex education, state funding of menstrual products in schools, implementing menstrual health paid leave at work, or improving public restroom access and sanitary conditions for menstruation. We'll give it a couple more seconds. Okay, it looks like our results show that most people think improving public restroom access and sanitary conditions for menstruation would be one of the best types of policy changes to make the most impact. Now we'll go ahead and resume our panelist questions. This question is to all, but I'll call on each one of you. What are some common myths or misunderstandings about menstrual equity? We can start with Lauren.
The first myth that comes to mind is the myth that only women menstruate. I believe that Representative Hernandez mentioned that she had trouble getting a bill passed that required all bathrooms to require menstrual products, including the men's restrooms. I think it is a really big misconception that only people identifying as women menstruate. Many people, regardless of gender identity, menstruate. Which can prevent people from feeling comfortable from supporting menstrual equity initiatives because they might not be comfortable expressing that they do menstruate, even though their identity is not aligned with being a woman. So that's the first one that comes to mind. And the second one that comes to mind is partially related, is that menstrual equity should only be pushed by menstruating people. Personally, in menstrual equity activists at Northwestern, our club is pretty much only women, which I believe is something that we should be fixing in the issue. Because menstrual equity impacts everyone, regardless of gender identity. Everyone has someone who menstruates in their life that they care about. So those are the two myths that do come to mind.
Thank you. And then Ida, would you like to share next?
Sure. I agree with Lauren and the points that she made, and I would like to add that I think this problem is something that is often thought of as a problem in the global south, and people are not really aware that it's happening in our own backyards. But we know that 1 in 4 girls in the US has missed school because she didn't have the product that she needed. And so, it is very much an issue that's happening here too. And another thing is that period poverty doesn't only affect your access to product, like menstrual products to take care of your cycle, but if you can't afford product, you also might not be able to afford things like heating pads or pain meds or like a TENS unit or other things that is helpful in order to manage the symptoms you have during your period and also access to specialists or proper medical care that might catch something like heavy bleeding, which is not normal. And, having access to treatment for those types of conditions is also something that not a lot of people have if they can't afford products.
Thank you. I'll have Allison next.
I think this touches on what has already been said, but a little bit more broadly is that menstruation isn't one size fits all, that there are different products and there are different needs for each individual that we need to address and consider when we're discussing menstrual equity. So, not everybody can use tampons, not everybody can use pads. Some people have allergies, right? And so making sure that when we're talking about equity, it is truly equitable and that we're meeting the individual where they are.
Thank you. And finally, we'll have Rep. Hernandez.
Thank you. And I think adding what Ida and Allison talked about is that menstrual equity is not just about providing free products, right? As we were having these conversations, there's a lot more that goes along with it. It's education, it's workplace, it's making sure that you have a safe place to go change, to that is a safe facility. So those are some things that are also menstrual equity on top of the products and on top of all the different things that we need to talk about and discuss and just also just go through as menstruators when we're thinking about having a menstrual uh, I guess a cycle. It's pretty much something that I think a lot of people don't think about. And now when you don't have those areas of a safe place of to change or have those products, or you can't miss work because of what currently standard is, it makes it hard for people to kind of just be able to go through their cycle and feel positive and feel pride of that too. I think a lot of people also think about their cycle as maybe as something that is not super happy because of their experience or their feeling, especially when it comes to like if they're feeling very bad or there is it's bad cramps or anything. I know I've had moments where I just want to lay in bed the whole day, but I know that I have to continue. I have to continue and go to work and do all this, and but I wish there was a way that I can just call off work one day and be and say, hey, I'm just having a rough moment at the moment. So that's one of the things that I think a lot of people are also have a misconception on.
Thank you. Those were all good points. My next question is specifically about schools. So this is to Lauren. What does a lack of access to menstrual products actually look like in schools?
That's a great question. So in my personal experience in Florida, that meant that a lot of people weren't able to attend school on a regular basis because they had a lack of access to menstrual products, so they had to stay home. This could also look like people missing school and their grades lowering because they are missing critical class time. This could mean them not feeling comfortable communicating with their teachers about them missing class and for what reason they're missing class, which can create a lot of shame and stigma around menstruation. In a college campus, however, this could be represented as someone having to work alongside studying. Um, which could decrease their overall academic success and time for other endeavors that they might want to pursue. And overall, this can just represent a lot more stigma around menstruation in general, because people may not feel comfortable asking for a period product from one of their friends or going to the health center and asking for menstrual products for free because they feel shame around not being able to pay for menstrual products. So this can create a lot of class divide on college campuses, especially ones like Northwestern, where a lot of students are paying a lot of money to go here, and some students are on complete financial aid. So overall, I think that lack of access to menstrual products um, can be very detrimental to the whole student body. Um, so yeah, I think that this is definitely an issue that needs to be addressed at all college campuses, not just ones like Northwestern.
I completely agree. As a student myself, I've seen multiple instances where my friends are kind of facing that chain reaction of events you talked about, where they don't come to school, they're unable to communicate with their teachers due to stigma and whatnot, and their grades fall as well. So I do agree that it's a really important issue to talk about. My next question is to Ida. How does period poverty affect students academically or emotionally? And I know Lauren kind of touched on that, so feel free to add on.
Yeah, I think Lauren touched on really good points. I think emotionally, ju just we know that when people don't have the product that they need, one of the things they do is to, wear the products they might have access to for longer than they are, you're supposed to wear them. And so sitting in class, sitting during a test and kind of worrying about what's going on in your body, worrying if you're going to bleed through your clothes, it creates a lot of anxiety. Lauren touched on the shame that's involved in all of this, and I think there's a lot of anxiety and depression that can be caused from not having the product, and then the worry of what's going to happen because you don't have the product. But I think when an individual starts missing school once they start their period, which can be as early as 8 or 9 years old. As Lauren mentioned, like it can really affect your grades, which then in turn can affect what classes you're allowed to take. You might not qualify for those advanced classes or the AP classes that you otherwise would have qualified for. And that might affect how you do on the SAT. And all of this might affect which college, university you might get into. And it might affect whether or not you qualify for a scholarship that, had you been in school at that time, that you would have qualified for. And so it really can have this snowball effect that can affect the rest of your life. And that is just like the academic piece of it. But there's also, you might not be able to go to sports practice or other extracurricular activities. And we know how important those are to, kind of become a well-rounded student and a well-rounded person, and how important that is for a lot of students. And so you lose that ability to fully participate in your life, and it can be devastating, both physically and emotionally.
Thank you. That is a really good point. My next question is to Allison, and then Lauren, if you want to add on after, that would be great. Some people say that schools have bigger issues to worry about. How would you respond to that? And we'll start with Allison.
I mean, well, schools must balance a lot of competing issues as it relates to student needs, parent needs, teacher needs, classroom management. Health and safety should always be top of mind for schools, making sure that students' health is at the forefront of the classroom, of the school community. Makes a lot of sense to me personally. There needs to be that assurance that students, regardless of, if they are somebody who menstruates or somebody who doesn't, that they can freely access their school environment. And this is what we have been talking about, where if a student doesn't have access to these products or they don't have access to services or resources to help manage symptoms of of menstruation, they might not be able to access their school environment. Thus, their grade slipping. Thus, they can't get into school. Thus, they might not get the same level of employment that they would in another world. Just as how Ida just said, menstruation is a natural part of students' daily lives, and it's a legitimate healthcare need, and that must be responded to by schools in a way that they treat students with dignity and respect.
Thank you. Lauren, did you have anything to add on to that?
Yes, I completely agree with everything that Allison said. I also have something to add on about the fact that students not coming to school because of their period could have social effects down the road. Not being able to create those connections among students is really important for just an overall like young adults development, which can impact how they enter the workforce, how they create friends in adulthood. So I do think schools that should be putting their students' mental health as well at the forefront, not just their physical health.
Thank you. We'll take a quick break from our panelist discussion and introduce our third polling question. What is the biggest barrier preventing students from participating in activism? The answer choices include a lack of interest, a lack of awareness, insufficient access to resource to make changes, or you're not sure how to start. Okay, it looks like our responses are in. Most people think that a lack of awareness is one of the biggest barriers preventing students from participating in activism. So it's a good thing that we're all on this call today to spread some awareness. Okay, continuing on, I want to talk a little bit about creating change. So this first question is towards Rep. Hernandez, and then Lauren, if you'd like to add. What is something high school students can realistically do right now to move this issue of period of menstrual equity forward?
Thank you. So one of the things I think students can what can they can do right now is definitely if there is no products currently in the restroom of your school, making sure you talk to the principal, the school board, anyone, because there's by law, by state law, they should be in the restroom. And I've heard from multiple students t saying that they're not there, either because the school refuses to put them in on either just on the women's bathroom or the male's bathroom, or they just think they're gonna vandalize the school, and that's why they don't put the products in, which is not a good excuse, and it's not helping the conversation. So if you don't see those products in your bathroom, making sure that you reach out to a school, to your principal, to the school board, making sure that they know that they need to include those products in the restroom. I know that She Votes Illinois did a great job by doing a email template and making sure that you are aware and how to advocate for yourself. So they really help you step by step in that. So if you don't have access to that, make sure you take a look at it. I know they dropped the menstrual toolkit. That's something that includes all the items that you can learn about. So that's a great way to start advocating right now.
Thank you. Lauren, did you want to add anything?
Yes, so from a high school standpoint, I think the most important thing that students can do right now is just talking about menstruation more openly. Just talking about it with their friends, with their family, with their teachers, with their community members. Just making it more normalized and less stigmatized in their community can really help in terms of getting people to support menstrual equity initiatives in the future, and getting more people aware that menstrual equity exists in the first place. This could involve them creating spaces on campus to talk about menstrual equity if they don't already exist, such as clubs such as menstrual equity activists, and making sure that educators are aware that this is an issue and getting support from them to support their initiatives. And also, from a high schooler standpoint, I think that because a lot of them aren't of age to vote yet, I think that submitting witness slips, like She Votes Illinois has been promoting, is really helpful at expressing support for legislation. And also emailing representatives, maybe parents also emailing on their child's behalf about the menstrual equity that they want to see in their schools and communities could help.
Thank you. My next question is for all of the participants. Or sorry, I think we'll do Ida and Lauren for this next question. What is an example of students successfully creating change around menstrual equity? And if Ida wants to start us off.
Yes, we work with a lot of student clubs that, do different activities to, start these conversations. I think every single person on this panel has talked about, the importance of normalizing these conversations. That is something that we see as well. We have students that will run product drives or have packing parties at school or during after school activities, during club activities. Those are great and really help kind of getting the product out to those that need it. And so that's something that we like to work with students to do. Um, and I think one thing that we have seen here today on this panel is the importance of voting. And since maybe high schoolers are not able to vote yet, talking to their parents, maybe older siblings or others that can vote about um, individuals running for office that and what they stand for and how open they are to talk about these issues. I think we're really lucky in Illinois because we have these state reps, state senators that take these issues on without much push from individuals or organizations like ours. And there might be some high schoolers here today that are about to go off to college, maybe in other states. And I would encourage you to figure out what's going on in that state because what's going on in Illinois is not really the case for the rest of the country. There are still 18 states that are taxing period products that don't have really anybody to do this work. And so if you can do that work, if you're away at college, I would encourage that as well.
Thank you. And if Lauren wants to go next.
Yes. So one example of something that students can do to create change is convincing their teachers to offer period products in their classrooms directly to kind of bridge that gap between school districts actually enforcing the menstrual product bill and students still having access to those menstrual products in the meantime from their teachers would be really helpful. This could be done like through a fundraiser, like maybe a GoFundMe or something similar where outside community members can fundraise for period products to be offered in classrooms, and not just period products, like any daily hygiene products that students may not have access to at home. And one example I can think of is actually menstrual equity activists at Northwestern managed to convince Northwestern residential services and faculty to offer free menstrual products in all university bathrooms. And that initiative is still ongoing currently. Right now, we're in the process of improving those dispensers and making sure they're actually getting filled regularly and also getting more better menstrual products in there and more variety of menstrual products, as well as replacing the dispensers to make them more accessible to everyone who menstruates, putting them in both men's and women's bathrooms, as well as making them more accessible for individuals with disabilities. So I also think that's something that students from a high school perspective can work on more of a legislative side by emailing their representatives, and honestly, like asking their administrators to support them on that, to make sure that everyone's being served properly for their menstrual needs.
Thank you for both your responses. I'm sure students that are listening today will carry on those objectives that you guys talked about. My last question is for Allison and Representative Hernandez. How can parents, educators, and community members support students in this movement? And we'll start off with Allison.
I mean, I think there's a lot of things that are a lot of ways that adults can support students. Um, Two that come to mind immediately is to listen and learn. Our experience with menstruation from decades ago should not be the same experience that today's youth have to go through. Improvements have been made over the years to better support students and make puberty less miserable. And I think we need, as adults, as the ones who do have the ability to vote, we are the ones that should be, making change, making it better for our students. And there are a number of ways that we can support students, with more tangible results. I mean, it's what we've talked about before, or on this call earlier about, having packing parties and providing products to individuals in our own community that we know are in need. It's donation, it is advocacy, but again, it's really listening to the needs of students, needs of youth, and making progress for them.
Thank you. And if Rep. Hernandez wants to go next.
So I think one of the things that I would want to see from parents, educators, and community members is educating the male counterpart. I feel like the currently we're not having enough conversation with them and educating them. Like, hey, if you see a dispenser in your bathroom, that doesn't mean you grab some and vandalize the bathroom or you try to take away the machine on your own, vandalizing the school or vandalizing wherever it is that I think having those conversations early on saying, hey, menstruators go through X, Y, and Z. This is normal. Don't make fun of them. Don't shame them. Support them. And if you don't need those products, then don't touch them because someone else does. I think that's very important, and that's currently missing in this whole conversation of equity and menstrual um, uh, items because it really is important, and I think this is something that a lot of people don't do. They just focus a lot on those who are menstruating and don't focus also on educating those that are not. And I think it would be easier for us if we start having those conversations and answering those questions. I know my male friends have asked me questions of, is it true? Is it just one dot? Is it really just a period and that's all you go through? Or is it only 3 days? And it's like, no, it depends on and every other person. So it's having those conversations for them to feel normal, well, not normal, but having that normal conversation, feel included, but also be aware of what we go through and why sometimes we don't feel like we want to talk to anyone or why we might feel a little extra feisty that day. But it's something that I think is missing, and I really want to see adults having those conversations with individuals.
Thank you. And that closes out our panelist discussion portion for the evening. I'd like to thank each one of our panelists today. All of your answers have been insightful and very inspiring, and I'm sure that we've all learned something important. I'd like to take a quick second to ask if the audience has any questions for us before we move on to our calls to action. Okay. If not, thank you so much, panelists. Again, oh, it looks like we have one question. What do you expect the future of menstrual equity to look like on a short-term and long-term scale? Does anyone want to volunteer to take that question?
I think I would love to answer because I do have a goal. When it comes to legislation, my goal is that hopefully we can see education on menstrual equity, but also menstrual products all over the state of Illinois. I know a couple of years ago I tried to do a menstrual product bill on small businesses and overall all businesses, and that was a little bit too much for many people. So we're going to try and tackle that in smaller scales and hopefully get to that point where we can have menstrual hygiene products for free across the state.
Thank you. Anyone else want to add to that? Okay. If not, thank you, panelists, for your time. And now it is my great pleasure to introduce She Votes Illinois board member Hamsika Tumu to share with us how we can keep this momentum going with some important calls to action.
Hello, everyone. My name is Hamsika Thuma, and I'm a current She Votes Illinois board member, and I'm also a senior in high school. And so I'm also a part of Menstrual Equity Awareness Week. I helped design it, and I also helped create our Menstrual Equity Handbook. And so today I'm going to be talking about how we can all, what we can all take away from our event today and things that we can do to further support menstrual equity in the future. So starting off, what can we do? What can you do as a menstrual equity activist, and what can you do in the future? So, three main things that we can do is we can support menstrual equity and advocate and outreach. So, what does that look like? So, ways that we can advocate for menstrual equity is specifically we can share the menstrual equity handbook that She Votes Illinois alongside Representative Hernandez, period, the Illinois Department of Human Rights. We all work together to create the Menstrual Equity Handbook for Illinois. So one thing that we can do is share this handbook so that students across Illinois know how they can advocate to ensure that menstrual products are within their school restrooms. We're asking you guys to read it and share with your school administrators because this simple action can have a real lasting impact and make sure that students know that their voices can be heard to make real change within their schools. Another thing is that you guys can use the Student Parent Advocacy one-pager. So this is just a short and condensed version of the Menstrual Equity Handbook so that it's accessible, easy to read, and also it gives you the tools to make sure that you know how to make change within your own community. This includes creating drives, advocating for, again, having menstrual products in your school, and also it's available in English and Spanish. The other thing that you can do is register to vote and help out people to get them voting as well, because voting is in a large important part of making sure that your voice is heard. And so registering to vote and getting out to vote will make sure that the people that you want to represent you in office and support the things that you also support, especially in terms of menstrual equity, are in office and advocating for the things that you're looking for. Other things that we can advocate for are also pieces of legislation. And so some pieces of legislation that we can support and we can advocate for by doing witness slips, also calling your representatives within the state that we previously mentioned within the event is the Construction Site Restroom Equity Act, the Iron Deficiency Training Act, and the Menstrual Health Workplace Equity Act. These are all state legislation that you can call your representatives, you can email them, submit witness slips to make sure that they get more support. And other pieces of legislation that you can also support that are federal are the Menstrual Equity for All Act, the Period Proud Act, the Pink Tariff Study Act, and the Good Samaritan Menstrual Products Act. So other ways you can outreach, you can advocate is you can join us for Menstrual Equity Spirit Day that's happening tomorrow. Another big part of menstrual equity is breaking down the stigma and talking about menstrual equity wherever and whenever. And joining us for the Menstrual Equity Spirit Day and telling your friends, telling your family members, telling your brothers, your sisters, basically whoever will get that word out and also help destigmatize periods and advocate more towards menstrual equity, which is really important. So the last thing that you can do to outreach is connect with She Votes Illinois. So staying involved and staying informed about different menstrual equity news is another way that you can advocate for menstrual equity. There's so many ways that you can take action, and it doesn't take much time. It's just the time that you have available to you to make a change and make a real difference. And so having a conversation with your principal, organizing a period product drive, sharing the one-pager, and connecting with us are all ways that you can do to advocate for menstrual equity, and all of them matter, whether it's large or small. So I want to thank you all for being here and being a part of this movement. And so back to you, Leah.
Thank you, Hamsika. Okay, we have our final closing poll question now. After today, what is one thing that you feel ready to do? Share what you learned online, start a conversation at school, join or start a club, research and support current legislation, or contact your local state legislators. And we'll go ahead and share those responses shortly. It looks like most of us are ready to share what we learned online and start a conversation at school. And of course, all of these things are really amazing and will definitely push for advocacy. This closes out our event for today. Thank you all so much for joining us. We hope that you feel informed, empowered. Don't forget to wear red tomorrow to continue supporting menstrual equity. And we'll be sending out a follow-up email to all participants, so make sure that you keep a lookout on your inbox. Let's work together to make menstrual equity a reality for everyone in Illinois. Thank you so much and enjoy the rest of your evening.
Thank you.